MLT Case Study Series 27. A case study on the topic. Application of Sudan black B staining in hematologic diagnoses. Utilizing Sudan black B staining to distinguish between AML and ALL, a comparative case analysis. Case study. Background. Sudan black B is a lipid-soluble dye used in histology for the identification of lipids, fatty acids, and some lipoproteins in cells. In hematology, the Sudan black B, SBB, stain is particularly useful in the diagnosis of certain types of leukemia, notably acute myeloid leukemia, AML. This staining technique can help differentiate AML from acute lymphoblastic leukemia, ALL, based on the presence of granular positivity in myeloblasts, which is characteristic of AML. Objective. To illustrate the diagnostic utility of Sudan black B staining in differentiating between AML and ALL. Materials and methods. Sample collection: bone marrow aspirate samples collected from 2 patients suspected of having leukemia. Staining procedure: the samples are treated with Sudan black B stain according to the standard laboratory protocol. This involves preparing smears, fixing the cells, applying the Sudan black B stain, and then washing and mounting the slides for microscopic examination. Microscopic examination: slides are examined under a microscope to identify the staining patterns of the cells. Case presentation. Patient A. Age/sex, 30-year-old male. Clinical presentation: presents with fatigue, fever, and abnormal bleeding. Laboratory findings: CBC shows anemia and thrombocytopenia. Elevated white blood cell count with blasts present. Sudan black B staining: positive granular staining observed in the cytoplasm of blasts. Patient B. Age/sex, 25-year-old female. Clinical presentation: presence with generalized weakness and lymphadenopathy. Laboratory findings: CBC reveals lymphocytosis with the presence of blasts. Sudan black B staining: negative for granular staining in the blasts. Results and interpretation. Patient A. The positive Sudan black B staining indicating the presence of granular positivity in the blasts is consistent with a diagnosis of acute myeloid leukemia, AML. This result supports the presence of myeloblasts which typically exhibit positive staining due to the presence of myeloperoxidase and other nonspecific esterases. Patient B. The absence of granular staining in the blasts suggests a lack of myeloperoxidase activity, which is characteristic of lymphoblasts found in acute lymphoblastic leukemia, ALL. Thus, a diagnosis of ALL is more likely for this patient. Conclusion. Sudan black B staining serves as a valuable diagnostic tool in the differentiation of AML from ALL. Positive staining is indicative of AML, whereas negative staining suggests ALL. This staining technique, when used in conjunction with other diagnostic criteria, such as immunophenotyping and genetic studies, enhances the accuracy of leukemia diagnosis. Discussion. This case study underscores the importance of Sudan black B staining in the diagnostic workup of leukemia. It highlights how simple staining techniques can provide critical insights into the nature of hematological diseases, guiding further diagnostic and therapeutic interventions. Nonetheless, it's crucial for medical laboratory technologists and clinicians to consider a comprehensive diagnostic approach, including clinical findings and other laboratory tests, for accurate disease characterization and management. Thank you. Please subscribe and support.